We talked about this with Paige, again, once we started researching it and we were laughing, we were embarrassed, it's an uncomfortable subject. But the more you learn and the more you talk about it, the more natural it gets.
Did you push record?
Welcome back to our second act. We're continuing our conversation on prostate health, and joining us is Dr. Laurie Blanscet. Laurie, welcome back to the show.
Thank you.
Well, as you know, this program is primarily for women, but today we are really talking to the men in our audience. And like we said in our previous segment, it's really for our benefit as well, because prostate health is something that affects couples, affects relationships. So the reason we're talking today is about prostate massage. We ran across this and started giggling about it, but as we look into it deeper, this is really helpful, or can be really helpful. What exactly is prostate massage and why is it important?
So the prostate can be reached through the rectal area because of the location, just so that you know. And the concept of prostate massage is, again, just like any part of your body, a muscle or a thing. When you massage it, it's going to help it to release the fluids. And so sometimes because we're sitting so much, we're more sedentary, not as active, men aren't maybe ejaculating as much, or there's just more toxins build up. For whatever reason, things get kind of backed up, so to speak.
I was just going to say, so men actually can get backed up. You heard that so often. Now we know what that means.
Exactly. For us women, we don't understand. But so the prostate massage is just basically gently massaging and putting pressure on the prostate to release the fluids, to cleanse, to filter, and get things to go through. And it makes sense, that would help.
Well, and the purpose of this segment, I guess we qualify, is really not to teach you how to do it, but to open your mind up to that this is okay. Maybe backing up just a little bit, pardon the pun. What are some of the telltale signs that somebody, over 50 especially, is dealing with a enlarged prostate?
The most common is it starts affecting the bladder, or the flow of the urine, because of where it's located. Because you have the bladder, then you have the prostate surrounding the urethra, and then you have the penis where this wonderful stuff comes out. And what will happen is when the prostate enlarges or inflames, it's putting pressure on that urine flow. And so men will get dribbling. They will feel like they can't empty their bladder. That's probably the most common symptom, or they just feel like they have to urinate a lot. So if you see a guy running back and forth to the bathroom, you start wondering. And some guys have pain, discomfort.
Like I said, with sexual dysfunction, which it leads into, the traditional approach to dealing with it again is will cause even more sexual dysfunction with some of the medications.
Think about that. It's like, and that's so often in medicine, which I like Second Act TV, is we expose these things and natural things to do, because sometimes we have one problem, we treat it, we create two other problems. And the surgery especially, yes, it will, basically they're shaving off the muscle so it's not constricting on the urethra, but there's nerves down there. And when you destroy those nerves, now the penis does not become erect and you have erectile dysfunction. So, and then the medications, of course, can cause side effects. So you're right.
Well, so what do people need to know about prostate massage? How do we remove this stigma about talking about it and actually doing it?
First of all, realize it's for your health, just like going to exercise at the gym, just like breathing. And it's important for the health of a male, and take off the stigma. Obviously, you're not going to do this in an elevator. We hope not. But, it really is safe. People think they're going to get infections or whatever reasons, or they're shameful, because we've been taught that's not a good organ. You don't do anything, right? You don't go up the rectum, because to do a prostate massage, you have to go up through the rectum. And so for a heterosexual male, that can be tough.
Yeah.
And there are so many ways to do this safely. It's very easy. So first of all, know that it's healthy, and be okay with it. And then research, there's many different ways to do it, and you can do it safely and sanitary.
Based on my research, there's basically three different ways, to do this. And again, we don't want to do an instructional thing here, but kind of summarize for us what are the best ways to do a prostate massage.
Sure. So one way, people can actually use their fingers, use gloves, but it doesn't get up enough, so we don't really advise that procedure. The other two ways are to have a partner who can actually get up there a little better. And then there's toys. There are actually toys that are designed, I call them toys, but they're tools, instruments, that are very safe, very comfortable, very easy to use, either by yourself or with a partner. That's what I suggest, because it's so much easier and you're not going to mess it up.
Well, and we talked about this with Paige, again, once we started researching it, and we were laughing, we were embarrassed, it is, it's a uncomfortable subject. But the more you learn and the more you talk about it, the more natural it gets. And, the idea that us as women can actually help the men and make it fun and
right.
That's something to consider, right?
Well, yeah, and it can actually enhance the male sexual response.
Mm-hmm.
So there are many toys and many fun things out there that you can use as a couple, and really enhance the relationship for men in that sexual experience. So why not?
Yeah. Exactly.
And help them be healthy.
One other interesting thing I saw, that one of the reasons that men are adverse to this is because they think when they hear this, that they think of a prostate exam, which can be very painful. And that's not what it is, right?
No, it's very gentle, especially with a toy, because it's so thin, it's so tight, it's so much better. And with a prostate exam, it depends. Like when I give them, I have small fingers, so but if you have big, thick old fingers, not so comfortable. And also, it's not a pleasurable experience. We hope people don't make it pleasurable in the doctor's office.
That's funny. So don't equate it to the rectal exam.
Correct.
So how would you counsel? Have you ever counseled a man on this or recommended this? How would you go about making somebody feel comfortable to do this?
Well, first explaining what the prostate is, which we've done, and then explaining that its function is not just for helping somebody get pregnant, but it's filtering, it's getting rid of toxins, and it's helping the conversion with testosterone to DHT, that they need the prostate to be healthy, and that we want to flush everything so it does not enlarge, and just educate them that how to do it. It's very, very simple, it's very easy, and if they do this regularly, pretty soon it becomes commonplace. It's like brushing your teeth. It really is. Well, maybe not that.
See, we're laughing, we're giggling. That's okay. And you guys can laugh and giggle too, because like I said, it's an uncomfortable subject, but it's one very, worthy to explore. And we're going to be linking to, there's a couple sites I found. I think I sent them to you, and I think you agree that, these really treat the subject in a very up and up matter, very matter of fact. And I would encourage you to visit and see if this is something that can really, change how you feel, right? Dr. Laurie, what would you leave our listeners, our viewers with?
I agree. Go to the links. They were very informative. They basically gave great information, great links to healthy toys that can help, techniques you can use. And I would just leave it with saying, hey, your prostate is part of you, just like any part of your body, and you need to take care of it. Don't wait until you have major issues. Start now. It's not a dirty, awful thing to do. It's a healthy thing. Just like women, when we get pap smears and stuff, it's something you do for your health.
Yeah, exactly. Well, thank you, Dr. Laurie. I hope that we, cleared up, or maybe, given you an idea of maybe how to take charge of your sexual health when it comes to prostate health. So thanks for joining us. We hope to see you soon again on another episode of Our Second Act. And don't forget to subscribe to our program so you don't miss any of these great shows. Bye-bye, Dr. Laurie. See you soon.
Bye.
I hope you enjoyed today's program on prostate health. As much fun as we had, it is a very serious and important topic. So be sure to visit our website. We have many links to great sites that give you more and detailed information on the procedures discussed today. And we hope to see you soon again on another episode of Second Act TV. Oh, and don't forget to subscribe to our program. There's the button. Thank you.